Hi, I'm Dr. Rachel Langley, and I feel like there's so many aspects of women's health that are still considered taboo to talk about. I mean, we can have ads for erectile dysfunction and low testosterone on the radio, for heaven's sakes, all the live long day, but as soon as I say postmenopausal vaginal atrophy, well, maybe those are just weird words that no one really says. But everyone kind of looks awkward and askance. But believe you me, if you are menopausal and you come into my clinic, I will be talking about this with you because it's important. So, what happens normally after menopause? So, your estrogen, progesterone drop so far away, and that's part of why you have hot flashes, things like that. That I feel like is reasonably talked about these days. But another thing that happens when you have that drop in estrogen is your vaginal tissue atrophies, meaning it gets thinner, it gets drier, it loses its function. Not okay. So, I mean, maybe women are living longer and longer, and so noticing this more and more, and I am a big fan of that, and I am a big fan of using simple, inexpensive treatments to make life better, because there's all sorts of symptoms you can have from having that thin vaginal tissue. I mean, as you can imagine, you can get dryness, and that can even, I mean, I've had women who can't even go on a walk because there's so much friction and rubbing during that walk, and the vaginal tissue is so thin and so dry that they have bleeding just from that. So now they're not going on walks either. They're not getting exercise. No, not okay. So they can sometimes will have burning of that area. They'll have spotting, like with the chafing. Sometimes it just happens with intercourse. So they'll have decreased libido because who wants that experience? Sometimes they'll have just bleeding after intercourse. Sometimes it'll even be in the tissue kind of in front of the vagina, so they'll have urethral or urinary type symptoms. It'll burn when they pee, and every time they come in for a presumed UTI, there won't be a UTI and they won't know what to do. They'll feel like they're going crazy. They might feel like they have to pee all the time. They'll have increased frequency. They'll have even blood in their urine. So maybe they won't notice vaginal bleeding, but they'll have blood in their urine from irritation, and the only time they see it come out is when they pee. So these are all pretty common symptoms that I see in postmenopausal women, and they just say, oh, there's nothing I can do about it. Now, it's a tricky situation too, because if you have gone through menopause, stopped having periods for a year, and start having bleeding, that's a worrisome sign for a cancer of inside your uterus or an endometrial cancer. So if it's a bleeding kind of symptom, we can't be sure right away that it's related to this vaginal atrophy. And sometimes you might need to go in and see a gynecologist for an endometrial biopsy. It kind of feels like a long pap smear. It's a little bit more crampy than usual because they're actually placing a little sampling tube inside your cervix all the way up into your uterus and collecting some tissue samples from up there and then looking at those under a microscope to see if there's signs of cancer. So that's especially if you're having spotting. You should probably have that done to make sure that you're not having a cancer that's causing the bleeding instead of this. But this is a really common condition too. Now, technically, the first thing to do is to go to your local pharmacy and look for a vaginal lubricant with hyaluronic acid in it. That's the go-to agent that's going to help. And so applying that 2 to 3 times a week might be all that you need to help the tissues to go back a little bit towards what they were back before you went through menopause and have these symptoms go away. Or sometimes just using a really good lubricant during sex. That might be all that you need if those are when your symptoms are coming up. But a lot of my patients say that's not enough and it's not doing enough. And so my favorite way to treat this is with a vaginal estrogen. So it's because of a lack of estrogen that you're having this. So replacing that estrogen makes sense that it will fix it. So this comes in a variety of forms. The probably most expensive form that I've seen is a vaginal ring that you leave in for a month, take out, but that can run $500. So a lot of my patients say that's not an option. And then the next most expensive is like Imvexy. It's these nice little capsules that are still pretty pricey, and they have estrogen in them. You place them 2 to 3 times a week, usually twice a week, right before bedtime. And that kind of dissolves over the course of the night and releases the estrogen and resolves your symptoms. But Imvexy is still pretty expensive. So my favorite go-to is, it is a brand name, Vagifem, but they're these little tablets. They happen to give me free samples, so that has, in this case, impacted that. I love this. It's a good price, even after you're out of the free samples, and they make it really easy for me to give samples to my patients. So you can just barely see at the top there's a little white thing. That's the little tablet. So it's not a capsule. It's just a tablet. So a little dry, powdery, but that's why it comes with these applicators. You insert them vaginally, press the little button on the end, and it releases the tablet vaginally, and it dissolves by tomorrow morning. And that has the estrogen in it that seeps into your vaginal tissue and helps it to be more thick and moisturized and back and healthy the way it used to be. They also have, this is a pretty good price, varies based on where you are. The least expensive option is to get a vaginal cream, compounded. And I mean, I just have a lot of patients that say the cream's not worth it. It kind of is oozy and goopy to work with. I mean, women don't even like, once in a while, yeast infection creams. They certainly don't like using a cream twice a week for the rest of their lives. That's going to be kind of oozy. But also, it's better than nothing. So if you're having these symptoms and that's all you can afford, use it. Use a pad. Make it work. But my favorite is the VagiFemme for sure. Good price, not too messy, works really well. And if it's not helping, there's still other things you can do. I mean, you might talk with your doctor about exactly what your symptoms are. Some women are actually having a lot of leakage, like urinary leakage, and that might be slightly improved by this, but you're also likely going to need pelvic physical therapy or a rigorous round of Kegel exercise progressions. I think I have a video on that. I'll try to link to that at the end of the video. And if you're continuing to have symptoms, especially if it's bleeding, then for sure you need that endometrial biopsy to make sure it's not actually cancer causing your bleeding instead of vaginal atrophy related to menopause. Now, some people hear estrogen and they hear that it's hormone replacement therapy, and that's scary because there have been some scary things said about going on hormones after menopause. I love hormones after menopause for most women. But in this case, I want to reassure you that it seems like this doesn't get into your bloodstream nearly as much as taking hormones orally does. So the vaginal suppositories seem to just stay in your vaginal tissue. So it doesn't seem to have an impact on breast cancer, on endometrial cancer, on heart disease, things like that. But as always, talk with your doctor about that and make sure you've hashed out the risks and benefits and make sure they're acceptable for you. Also, if you've had a cancer that has been impacted by hormones, it doesn't seem that this vaginal estrogen will increase your risk of having that cancer again, but that's definitely something to talk with your oncologist about. Usually oncologists, especially ones that deal with breast cancer, are pretty expert on this. Most that I've talked to think that it's worth it. Unless it's been a particularly estrogen-sensitive cancer, that being on vaginal estrogen seems to be a reasonable thing to do, especially for bad symptoms. If you know anything about hormone replacement therapy, you know that usually if you're on an estrogen and you have a uterus still, meaning you haven't had a hysterectomy, you need to be on progesterone as well to kind of balance out the estrogen's impact on your uterus, your endometrium, building thicker and thicker and thicker with that estrogen. The progesterone needs to be there to keep it a little thinner and decrease your risk of a cancer growing there because it's growing so much. In this case, since it's just vaginal, you do not need that. You don't need a progesterone to balance out. A vaginal progesterone is what the research is showing so far. So hopefully I didn't it was kind of a clickbaity title. I haven't really had what single medication. I don't know. See what you think of it. Hopefully it was helpful to you, and thank you for watching. I'll post the link to that video that you might find helpful as well right there. And please subscribe to my channel so that when I release new videos, you can find out about it. Thanks for watching.